Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
You are evaluating a 71-year-old female patient and have made a diagnosis of major depressive episode moderate. The patient is agreeable to pharmacotherapy. When considering pharmacologic treatment options, you review her existing medication list for potential interactions and contraindications. Which of the following classes of medication might increase the patient's risk of cognitive impairment with the addition of an SSRI? So this is a very specific question. I mean, we know in general that the older adult is just more sensitive to adverse effects of medications, period. So there are several resources available to us that we can review our pharmacologic considerations and make decisions about the safest approach. You are probably familiar with the Beers criteria. It's been around for a very long time. It is an increasingly growing list of medications that's published by the American College of Gerontology, and it just lists medications that should be used cautiously or avoided in the older adult because of the risk of adverse effects. And then we have the stop-start criteria, which is a screening tool that you go through and you address various questions and make a determination about whether or not the medication is the risk-benefit ratio favors benefit. But this question is very specific to SSRIs and cognitive impairment and which of the medications in our patient's med list can actually increase the risk of cognitive impairment along with the addition of an SSRI. So your answer choices are a calcium channel blocker, an antiepileptic, a diuretic, and a proton pump inhibitor. And again, if you're not sure and you have to reason your way through it, you really can do that. So think about what we know about SSRIs. They are in many ways very safe. They are very well tolerated. They are not drugs of abuse, and for lots of reasons we like them, and they are often our first choice when appropriate, especially in the older adult who is more susceptible to some of the adverse effects of other heavier duty antidepressants like tricyclic antidepressants. So for many reasons, we love the SSRIs, but they are still pills, and all pills are a poison. You know the mantra. The very first thing you learned in pharmacology is all medications are a poison. The question is just, does the benefit outweigh the risks? So while SSRIs in many ways are very safe and they're well tolerated and we like them better than other antidepressants, they are still a medication and they still have their issues too. And one of them is the potential for hyponatremia. As a class, SSRIs have a tendency to increase the likelihood of hyponatremia. And in the older adult period, even as monotherapy, that's an increasing risk because the older adult population has a tendency to pseudo-hyponatremia. So add in the SSRI, and it really skews the way that you interpret the sodium. And we know that we worry about hyponatremia in anyone because when a patient becomes hyponatremic, then that means that the osmotic pressure gradient between the intracellular environment and the extracellular environment shifts. And it shifts to the extent that there will be an intracellular movement of fluid to try to normalize the osmotic pressure gradient. And unfortunately, when fluid shifts into the cell, you will get cellular swelling and cellular edema. And when this happens in the brain, you get cerebral edema. And so in the setting of cerebral edema, we worry about mental status changes, delirium, acute stages, cognitive impairment, and even seizure. So we definitely don't want it to happen. So this question is very specific to what specific drug in her medication list can increase that risk. And C is the correct answer. The concern with the diuretic is that both SSRIs and diuretics can lead to hyponatremia. We know that SSRIs can promote hyponatremia, and we know that diuretics in general are medications that promote the offloading of certain electrolytes, and sodium is among them. So you put these two together, it increases the risk of hyponatremia, and that increases the risk of the consequences of hyponatremia, which are cerebral edema, intracellular fluid movement, cerebral edema, and then the consequent mental status changes, cognitive impairment, etc. It doesn't necessarily mean that the combination is flat out contraindicated. It just means that careful patient selection is necessary, appropriate monitoring is necessary, and like with every other drug, you'll decide risk-benefit, make an assessment, and if you feel like the SSRI is the best way to go, just do your baseline electrolytes and then be on the lookout to monitor them. And of course, you want the patient to let you know immediately if they notice any changes in their level of cognition.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit fhea.com.